This drug has all of the key elements to be a 5-star option. However, there's one major issue with it that prevents it from reaching that 5-star status. And if you stay tuned, you'll find out why. Welcome to another review. We're going to go over how good is Trulicity compared to the other options that are available, which there are many, and then how much does it cost compared to those other options. And based on those two factors, we're going to give our review. For type 2 diabetes, there are a lot of different drugs that people can take. So in order to make this a little bit easier, what I'm going to do is pull up a chart from the American Diabetes Association. I'll link to it below, but it's got a very useful chart of the major drug classes that are used in type 2 diabetes. And just know this is not by any means an exhaustive list. There are a few others that are less commonly used that are not on here. Moving back to the chart over here, we're going to very quickly compare Trulicity versus the other options in that high-level view that we had mentioned briefly. So firstly, looking at its efficacy, Trulicity has a very potent ability to lower A1C blood sugar. And this chart is actually not the best for making this comparison, mainly because it's grouping all of the GLP-1s together. Trulicity is a GLP-1 receptor agonist, and there are some weaker ones in there like Bydureon that just don't have as potent of an effect. So that's why it's sort of rated equivalent to these other classes, metformin, thiazolidine, diones, and sulfonylureas. So just speaking, let's say, about the ceiling effect of these drugs, because the A1C lowering effect is really going to depend on the dose. So what about the ceiling effect? That's a little bit more consistent. The ceiling effect of metformin and these other classes of medicines is typically going to be around, it really depends on your starting A1C, of course, but typically it's going to be around 1.2 to 1.4 or 5, somewhere around there, change in A1C, minus 1.5, let's say. Whereas Trulicity, the floor effect is typically around 1, 1.2, and if you take the higher strengths, and depending on what your starting A1C is, it could be easily over 2%. So typically, Trulicity is going to have a more potent effect than these classes of drugs, although these classes of drugs also do have quite a potent ability to lower A1C. Some of these other ones, DPP4s and SGLT2s, they're just not quite as strong. Typically, you're looking at about 0.5% to a little bit less than 1%, so not quite as potent of an effect of lowering blood sugar. The next category we're going to have a look at is the hypoglycemia. GLP-1s like Trulicity lower A1C or blood sugar in a glucose-dependent manner. So the more glucose there is, the more of an effect it has. The less glucose there is, the less of an effect it has, which means that it has a lower risk compared to other groups of medicines of developing hypoglycemia while maintaining that very high potency and ability to reduce A1C. Some of the other classes, such as the sulfonylureas, it has a potent ability to lower A1C, but it also carries a high risk of hypoglycemia. Same thing with insulin. Insulin almost has an unlimited ability to lower A1C, but you can definitely go way too low and put yourself at risk for hypoglycemia. The next category would be weight change. For some people, this may be a benefit. For some people, it may not be. Most of the doctors are going to want people to lose weight because typically people that have diabetes may have a weight issue that could possibly affect their health. Not all weight issues may affect your health, but that's you'd have to talk to a doctor about that. With GLP-1s like Trulicity, there is a weight reduction effect, which most people do like, even if it may not be necessary for their condition. And even if it's not a medical issue, a lot of times weight gain, let's say, can create a psychological issue where if people don't feel good about themselves, often it just can create a vicious cycle where they may not want to invest in themselves. So these drugs like Trulicity have a very potent ability to lower weight. And compared to most other drugs, they have a weight gain profile. If you look at the only other options really that reduce weight are the SGLT2s and metformin, which has a modest ability to reduce weight. Next are the proven benefits, let's say, in ability to reduce problems long term, or outcomes, as some people call them. One of those being cardiovascular disease. So one of the main problems with diabetes is that it causes people to age more quickly, and also people to develop cardiovascular problems more quickly. And I actually have a different video on my old channel that explains some of the mechanisms of advanced glycation end products, but I won't talk about them here. But just know that Trulicity does have a proven cardiovascular benefit in its ability to reduce things such as heart attack, stroke, other cardiovascular outcomes. So that's always going to be very important when selecting a drug, because we're trying to treat problems to prevent issues from happening either right now or in the long run. And with diabetes, a lot of it is about the long run. And the fact that Trulicity does have that proven benefit in clinical trials to reduce this is beneficial, where there are many other medications where they are lowering A1C, but there may not necessarily be a proven benefit. Maybe there's a theoretical benefit, but it has not necessarily been proven. So that's a very positive thing. Lastly, we'll look at are the side effects. So we'll very briefly mention these. There are a lot of side effects potentially to go over, and you'll always want to discuss a doctor, your individual situation. But Trulicity has very few medicine interactions, which is a very big positive. Some of the other oral diabetic medications will interact with drugs that may cause them to be more or less effective or cause unwanted side effects. There is a theoretical risk of certain types of tumors that was seen in rodents. If you're interested in this, because this is sort of a long topic, if you're interested in this, I can make a separate video about it, but just know that it doesn't seem to have manifested in any meaningful way in people unless they're already predisposed to this type of tumor, and I'll basically leave it at that. Aside from that, the main issue is the gastrointestinal side effects of the drug. So it's associated with nausea and vomiting in some people, and that's typically why you start in the lower strength and then move up onto a higher one, because it does seem to dissipate with time for a lot of people. Outside of that, there don't seem to be any long-term effects so far that have shown up. Again, so far. Who knows? Time will tell if maybe 20 years or 30 years down the road there might be something to worry about. And that's often why some of the other drugs or older drugs may seem worse, quote unquote, than the newer drugs. Not necessarily because they are, just because they've been around longer and we've had more time to identify potential issues or long-term effects with the medications. But many of the other drugs have long-term effects or potential risk for long-term effects with use. Some of them are associated with fractures or SGLT2s. Often it causes you to basically pee sugar, so it can cause urinary tract infections, other issues. Some of these other drugs too are possibly associated with a cancer risk or fractures or other issues. And again, some of them will raise cholesterol. If that's an issue for you, then that could be a problem. GLP-1s typically don't have as many interactions or at least other known side effects that can cause an issue. So now that we got that out of the way, how does Trulicity stack up against the other GLP-1s? So we're going to talk about Bydureon, Victorza, and Ozempic. So versus Victorza, there was a head-to-head study done quite a while ago versus the second lowest strength of Trulicity. And what that study found was that they were about equivalent in lowering A1C. And Victorza had a little bit better of a reduction in weight, but it also had slightly more nausea and vomiting as far as the side effects. So Trulicity has a little bit more versatility in comparison to Victorza in that there are lower strengths for people that can't tolerate the higher amounts. And then there are higher strengths in that if people are looking for more A1C reduction and more weight loss, those are available. With Bydureon, there hasn't been a head-to-head study, but Bydureon definitely has the weakest effect of the GLP-1 class. And that's not necessarily a bad thing. It's just, it is what it is. So Victorza did a head-to-head study versus Bydureon, and they had a significant A1C reduction and weight loss versus Bydureon. And Bydureon also did a study to confirm if there was a cardiovascular benefit, and it did not. So it doesn't necessarily mean there couldn't potentially be one. It may just mean they have to do the study for longer in order for it to show up. But of course, if it doesn't lower sugar as much, it's not going to appear as quickly if it appears at all. But Trulicity, again, it has a lower strength that's sort of competitive with the Bydureon, but it also has higher strengths that you can use if you need more effect, essentially. So it has that advantage in that regard. Lastly, versus Ozempic, which is kind of the other very popular GLP-1, there was a head-to-head study done by the makers of Ozempic versus Trulicity, and what they found was that Ozempic was more effective. Their lowest strength was more effective than the lowest strength of Trulicity, and their highest strength was more effective than the second lowest strength of Trulicity, which is good. It also has a cardiovascular benefit as well. But again, the issue with a lot of the GLP-1s is that they're hard to tolerate because of the side effects. And what you actually look in that head-to-head study is that on the lowest strength of Ozempic, 20%, like almost 25% of people had nausea. That's not really good for a low strength. So it is effective for people that need that and can tolerate it, but it doesn't have lower strength. So again, Trulicity just has more versatility than these other drugs, which is why lots of doctors pick it as the go-to option, because if people need lower strength, they've got it. If they need the higher strength, they have it as well, because they have the 3 milligram and the 4.5 milligram. The Ozempic study was done against the 1.5. So when you compare the higher strengths of Trulicity to Ozempic, they're approximately the same in the A1C lowering effect and weight loss effect departments. Next, the cost. And this is unfortunately where Trulicity loses a lot of ground. It is just one of the most expensive drugs on the market, and it's not very affordable to a lot of people. So first, looking at the other options, there are a few classes of drugs like metformin and the sulfonylureas that are generic, and these drugs sometimes are even free at certain pharmacies, but you're looking at paying less than $10 for any of them. Even other brand name drug options like the SGLT2s and the DPP4s and even insulin, which gets a lot of flack for being super expensive, it just doesn't hold a candle to Trulicity. Trulicity, the list price is about $800 to $900, and probably it will be over $1,000 soon. And for commercial patients, for example, they'll give you $150 off, where if your copay is $150 or less, then that's fine. But if you have a deductible, then you're going to have to pay $700, $800. It's not uncommon to have a copay that's $300, $400, $500, $800. That's not unheard of at all. It's actually very, very common. It also needs authorization through insurance lot. And speaking of that, if you need help getting coverage for this drug, definitely give us a call because we do a lot of it. But moving on to the other options as well, the SGLT2s and DPP4s, for example, their list price is about $400, which is still a lot, but they might help you out as much as like $250 a month, or they might have patient assistance programs that are fairly easy to get into that you can get help on the drug, no matter what type of insurance you have. And the income levels are more reasonable for the amount of the drug, the price of the drug. Trulicity, however, they do have a patient assistance program, but the income is relatively low based on its price. I mean, the price of this drug is so high that it really ought to be in the specialty tier in most cases. And the assistance is really priced, is geared around towards it being a mass market drug, which it is, but it's not priced like a mass market drug. So this is not a very affordable option compared to the other options. However, compared to the other GLP-1 receptor agonists, it is one of the best options. Bydureon has a slight edge in that they're willing to give you $300 a month to cover the cost of the drug. But again, these are all based on right now. They can change at any time, so don't quote me on that. Their patient assistance program is about the same credential-wise, and to get in is not too bad. It does, I would say, significantly beat Ozempic and Victorza. They are pretty much in the same boat as far as they offer $150, but their patient assistance program is just god-awful to deal with and to get into. I just wouldn't recommend anyone try to do it. It's not uncommon to be on hold for about 5 hours, and I'll put some phone records up here just so you know that I'm serious. I've even had people that have told me they've spent over 24 hours on the phone trying to deal with Victorza and Ozempic. So with Trulicity, it's a pretty reasonable process. Again, it's not as, the income is probably not where it should be, especially in a lot of the higher earning income states like California and New York, to where it's probably just too expensive for a lot of people there. But just know, as far as how it stacks up against other GLP-1s, it's definitely the top dog, with Bydureon having a very slight edge for commercial patients because they're willing to offer you a slightly bit extra. Our final rating for this drug is a 4 out of 5. And the only reason it's not getting a 5 out of 5 is just because of the cost. It's just too expensive for too many people. And would it be worth the price? Even at those $500, $600, I mean, your health is your health. There's no amount of money that you can attach to that. So you could say it's worthwhile. However, at those prices, yeah, there are lots of other drugs that you could get for way less, even other brand name drugs for, a fraction of the cost, $50 or less. And the unfortunate truth is once you get up to $500, $600, $700 a month that you'd have to pay out of pocket for the drug, there are other non-drug options that become viable, like personal trainers and dietitians. Normally people don't go that route because despite whatever people say about drugs, they're typically the most cost-effective option. But if you're paying $500 a month on a medicine, well, these other options start becoming more viable, and those typically are probably going to be better than taking a drug. So for that reason, we got to dock it a little bit and give it a 4 out of 5. If it was a little bit more affordable, I would definitely give it a 5 out of 5. I hope you found this video helpful. If you ever need help with the cost of Trulicity or getting it covered, we deal with this drug a lot. So we have a lot of experience with this. We have a very good success rate in getting it covered and getting it at a decent price for you. So feel free to fill out the contact form, give us a call, send us an email, whatever you like. I hope you found this video helpful, and we'll see you next time.